Hello, I'm Dr. Ruth Roberts, your pet's ally. I thought we could have an actual fireside chat today. It has, I woke up to, it was 60 degrees yesterday, and we're in Santa Fe, New Mexico, and we knew the storm was coming, but woke up to 34 degrees and an inch or so of snow. So we kicked the fire up first thing this morning. It's all nice and warm and toasty here. Thanks, April, for getting Sita the form to fill out. We're sorting through some issues, and it's 22 where you are. I can believe it, because you're pretty. I think you were a little bit south of Salt Lake City. Am I remembering that correctly, or more in the mountains? I really can't remember, but I know it was bloody cold. So thanks for joining me on the other page. For some reason, this version of Ecamm Live won't let me post comments in the thing that it plays with. So let me see if I can get to this without creating some sound feedback, so I can talk to you guys. There we go, in live. All right, so thanks for joining in. A couple of questions. I hope the whole calcium thing last week was fairly clear. So that it is a very confusing topic. So we've got a couple of questions to answer for you here, and I pulled the other ones off of the other broadcast so we can answer them more appropriately here. And the reason I try to answer specific questions about your pets in this page is that we have a relationship, and so I'm going to be less likely to get yelled at by the powers that be. So to launch into all of this, Denise, I'm so sorry to hear about your buddy. So it sounds like the ultrasound kind of didn't turn up anything. It sounds like the prednisone is helping somewhat as far as bringing the calcium down and helping them feel better. And what I would do is presume that this is something that's probably hiding in the bone marrow. And I'm sure that, other options would be to do things like bone marrow biopsies and yada, yada, yada. But how much is that going to provide benefit if you don't have a specific thing to treat? So this is where I would go back to that cancer support protocol and use things like the herbal formula that transforms phlegm, as well as the invigorate the collateral. So I think that's Panelia, phlegm, something or another formula, and then the invigorate the collaterals. Again, just as I talked about with Biscuit, what you've got to do is layer things in. So again, if your pup is not eating super well, then using a ton of supplements is not going to make things better, if that makes sense. So what I would start with is just really, really nice congee type foods, and so almost go with the cat starter recipe. So basically the chicken or turkey or something like that, that's a great chi tonic. That's going to be a little bit warming, because at this point the chi and the energy is way down. Adding in things like butternut squash, more carrots, the nice winter squashes to kind of support. And then really, so cooking rice down well. So a congee, which is used both in Ayurvedic medicine and traditional Chinese medicine, is essentially a rice porridge, because rice is the most common grain there. And what you would do is add almost double the water. So if you're going to cook a cup of rice, normally you'd add about 2 cups of water. So you'd add actually 4 cups of water and cook this down till it's almost a gooey paste. And essentially what you're attempting to do with this is to pre-digest the food. Same thing with the chicken. You're going to want to cook it really, 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 really well. And that's kind of part of the point, is that, you know, your pup's GI system isn't working well because it's so sick. So if we make it so that there is less work for the GI tract to do, then we are much more likely to be successful in having the food nourish and be taken in more readily. Does that make sense? Yes, it's going to destroy more of the nutrients, but if you get in a cup of food versus a quarter cup of food, you've now tripled the amount of calories that are going in, and it will, you know, get things stabilized and then sort of sort out the rest. So you're using prednisone already. If you're not using some sort of an appetite stimulant, which I think you are, definitely add that in as well. And then see if you can find a veterinarian that can do acupuncture for you. And really what you're needing is somebody that can just get things moving again. So I talked about that point shungen, which is on dogs, it's at the haired and non-haired region of the nose. And and I'll post a picture of Mona with a mark on her nose about where things are. But you can also stimulate that with your thumbnail, and that tends to help quite a bit. So I'll post you that picture up, and then I'm going to post 2 practitioner lookups. So one is from tcvm.com, which is Dr. Shea's Chi Institute, and then IBS is the International Veterinary Acupuncture Society. And let's see, and that one didn't come up, so let me write that in again. So you can just click on it. But this way you can find hopefully find a practitioner in your area. So, Denise, I hope that's helpful. Those are the things I would start with. If you're starting to get some traction that way, as far as getting your baby to eat a little bit better and feel a little bit better, and the prednisone is beginning to make a difference as far as getting the calcium down, awesome. The other thing you can talk with your veterinarian about, and again, this has to make sense for you and your pet, is something like metronomic chemotherapy. And essentially what that is using chemotherapeutic agents at a low dose on a daily basis. When I was in practice, I used cyclosporine quite often because that hits sort of the broadest spread. The main side effect for that later down the road is something called hemorrhagic cystitis, and basically that means that the metabolites of cyclophosphamide have irritated, and I hope I said cyclophosphamide the first time, but at any rate those metabolites have irritated the lining of the bladder, and literally they're starting to pee blood because of that. It's annoying, it can be uncomfortable, but it's also something that's manageable. In looking at follow-up blood testing, what typically gets done is a CBC 2 weeks after the cyclophosphamide has been started at that lower dose, and as long as the white cell counts are not dropping, then it is safe to continue. I would normally recheck that 6 weeks after the initiation of therapy, and then if it's good, then we check it every couple of months just to make sure we're staying out of trouble. That made an enormous difference for a ton of my patients, as far as very few side effects, and the pet, just the cancer got under control. I have a dear friend, Sarah's dog Coco had a spinal tumor, and she stayed really in good shape for a long time. It was amazing. I think it was either 18 months or 2 years before Coco sort of got overwhelmed by the cancer. And I won't tell you that she stayed problem-free the entire time, but she was able to stay happy and with Sarah and her family for that 2 years versus, I don't know, I think the ER vet was, it was going to be another $6,000 or something insane, and surgery, and maybe maybe 2 months of life. So that was an awesome option. Now, the other questions, Bettina, actually not a question, but I swear to God, I should just contract with you to make a cookbook photo shoot for me, because all of you do, but I mean, you produce these beautiful batches. Maybe that would be fun, huh? Have a cookbook, a Crock-Pot chefs or cooks community cookbook PDF that we could publish and then use it to benefit one of our favorite dog charities. That would be awesome. So beautiful stuff. Anne was asking about chicken, and is it a good thing to use? And Anne, yeah, it is. It's getting colder. Chicken's a great chi tonic. It's a little bit warming, so perfect for a day like today. A better option probably, and I think you ended up deciding to go back to chicken, boneless, skinless chicken breast, but a better option and a less expensive one are actually chicken thighs. You can find those. They're a little bit more expensive, but I used to be able to get them at Costco for $1 a pound. If you're really worried about fat, it won't take you too long to pull the skin off. And you just throw them in the pot. All you have to do is pull out the thigh bone and you're good to go. I usually would leave the ends of the bones in because that's all cartilage, and they would get ground up with the immersion blender. So that's a great option. And April, yes, that's how it looks with all the greens in it, and that's wonderful. And it is sad that all your beautifully colored veggies sort of lose their colors. I remember I got a bundle of rainbow chard and cooked it, and it was like, oh, this is just green. But the upside is that all the phytonutrients that are associated with those colors are still in the food itself. And then you also asked about the quinoa coming out whole. Quinoa is a little bit interesting, and so what I would do is, again, cook it much longer, cook it by itself, and cook it off, cook it much longer than you think till it turns kind of mushy. Again, dogs are, they don't have cellulase, which is the enzyme that's used to break down the cell walls of plants, and so that's part of why it's difficult to get everything digested and broken down. And Sita, it looks like you did get the questionnaire, which is awesome. With confirmed Cushing's, I know we're going to talk at some point in the not too distant future, and so what I would not do is change anything until we're able to talk, especially if you feel like the trilostane has been helpful in controlling the Cushing's. And I'm not sure why they started you on that prior to getting the confirmatory test, but that's a whole nother bag of wax. And then April was asking about yogurt, which one to use. That's an awesome high probiotic yogurt. That's great to see that that is available now. And yes, April, in terms of the quinoa, no. If it's coming out whole, they haven't touched it. So that's why it's important to really cook it down and get it to the point where it is digestible. So, and this is what, for all the stuff about raw, this is what freaks a lot of people out. Yeah, you really do need to cook this stuff. And again, what we're doing is pre-digesting the food so it's easier for your pet to actually absorb the nutrients from the food. So with the yogurt, personally, I would choose a high-fat yogurt with no honey if that's possible. But, if your goal is to add in maybe a tablespoon with every meal, then I think that's fine. If it has honey or doesn't have honey. And high fat's always my preference. I think it just makes it easier for us and for our pets to absorb things. So, okay, Sita, cool. So we'll talk soon, hopefully. If you're having trouble getting a time to get a consult done, just let me know and I will get you a link to get that time set up. All right, any questions I haven't covered for you all today? Anything else that I've missed? I think we've got it covered. So are you guys freezing or I mean, we've got everywhere from 22 degrees for April, and Trisha's at 87 degrees. So it's just kind of crazy. And I think this stuff is all moving east, so I'm sure things will start to cool down as this storm rolls through the rest of the country. Yeah, and Trisha, exactly. Buy raw milk and make your own yogurt. There's a great way to do that. So if the problem is that there's this whole idea about wild cultures versus sort of specific cultures. And April, the yogurt you had would be a great way to inoculate your own batches of yogurt. So that's a great way to go. And then April's asking about the difference between IBD and IBS. You know, those terms get batted around quite often. So inflammatory bowel disease, I think, is that's sort of the diagnosis when it is chronic and ongoing. Inflammatory bowel syndrome is when you have sort of periodic flares of it. So once something goes from a syndrome to a disease, these symptoms tend to be much more exacerbated. And interestingly enough, I'm reading a book called An Epidemic of Absence. And essentially what's being, a theory that's being proposed is that much of autoimmune disease, whether that's simple hay fever allergies, things of that nature, all the way up to IBS, MS, you know, the Crohn's disease that can be associated with IBD or IBS in humans, are actually due to the fact that our immune systems evolved to be with parasites. And in many cases, they're intestinal parasites. And the interesting thing about this is that there is a species called Nectorius americanus, I believe that's correct, in humans that is there, but it doesn't really create disease. But what scientists are beginning to see is that as hygiene improves and as people get more and more dewormed, they can see the incidence of autoimmune disease begin to take off in that particular population. So that's pretty fascinating. And so that makes me wonder, you know, I said all this too, because that was the best information I had at the time. But in the Southeast in particular, we use heartworm preventives every month, every 30 days to every 6 days, depending on your take on things. And we've watched the incidence of autoimmune disease, IBS, IBD, allergies, autoimmune hemolytic anemias, you know, you name it, bullous pemphigus, just skyrocket over the last decade. And so it begins to make me think that is what's going on. So there's this, on the human side with chronic disease, most doctors will fall into the camp of, oh, it's chronic Lyme disease. No, it's mold exposure. No, it's Epstein-Barr. So all of these things will show up. You can test positive for all three of these things. So what really caused your symptoms? And that's the big question. And this is part of what I've been struggling with over the last several years. And so it got to me, it's like there is something else that we are not comprehending here that is actually creating the symptomatology related to all of these diagnoses. So again, there's the difference between a syndrome and a disease. So what is the thing? In Chinese medicine, when they don't understand something, they call it gu, G-U. There's also gu qi, food qi, and this is the kind of confusing thing about Chinese medicine is that, you know, one word can have very different meaning depending on the form of the character that is actually written. But the classic character for gu is a pictogram of worms in a bowl, worms in the belly, basically. So I find that very interesting. Yeah, crazy stuff. Sita, I will reach out to you shortly to make sure we get something scheduled so we can get you some answers. And then lastly, as I promised, the link, your special link to the iPets Ally offer, and let me pop that in here. So because you all have supported me so much, I wanted to help you a little bit more, and I also will love to have your input on this. But essentially what you get is 90 days, 3 months for $1. And then after that 90 days, then it's, I think, $10 a month or something. But we're going to start on the 21st with a live broadcast talking about emergency room visits. And I have a story to tell about that next week too. And Tricia, I think you're right. There's different things, but I think there's all these things. What is it? And we all have to live with these things in our environment, the glyphosate, the drugs, all of that. But there is something, some of us are very, very healthy still, and some of us are not. So there is something else going on, I think, that we don't quite comprehend as yet. And some of it's going to be genetic, but some of it is a missing environmental factor. So check it out, the epidemic of absence. Very, very interesting look at things. So ladies and gentlemen, until next week, remember your pets have, yeah, leaky gut. Yeah, so that's, again, is that the cause, or is that just a syndrome secondary to altered immune function in the gut? And that's kind of the big question. We can identify all these things that if we treat, we get these guys significantly better, and in sometimes cured, but in sometimes it's just significantly better and maintained. So there's still something not quite right there. So until next week, remember, your pet's best health starts in the bowl, and have a wonderful week. Give everybody a big hug, and thanks for taking care of each other. Bye.